The left atrial appendage is the most common site for thrombus formation in patients with AF, particularly in those with poor anticoagulation control. In patients with non-valvular AF, the incidence of LA appendage clot reported as high as 15 to 20%. However, it's important to note that the mass in this video is not LA appendage thrombus. This video shows a clear LA appendage in that patient free of any clot. So let's dive into the differential diagnosis of LA appendage thrombus. First, a left atrial tumor. It can present similarly to LA appendage thrombosis, but the tumor's attachment to the LA appendage is rare. Second, pseudothrombosis or artifact. Artifacts such as mirror imaging or side lobe artifacts can create a false appearance of thrombosis in the left atrial appendage. Last but not least, another differential diagnosis is fibrin clumps in the pericardium. A small pericardial effusion, particularly those with fibrin clumps in the transverse sinus or around the LA appendage, can appear as a thrombus, just like this view. In this view, we observe a pericardial effusion with large fibrin clumps that resemble a thrombus. This is 3D view of the pericardial fibrin clump. Although its appearance is similar to a clot, the fibrin clump is located outside the atrium. This is the 3D view of the left atrium, where we are positioned posteriorly looking at the mitral valve and the LA appendage. As seen, the LA appendage is clean and a very thin wall separates it from the adjacent pericardium. This is why a fibrin clump in the pericardium might be mistaken for a LA appendage clot. This is another 3D view of the left atrial appendage and the pericardium next to it, with the transverse pericardial recess illustrated as well, the most common site for misinterpretation. Misinterpretation can easily occur, particularly in the transverse sinus area, where the pericardium and the LA appendage are close proximity. So when examining these cases, it's important to keep in mind that pericardial effusion with fibrin clumps can closely mimic true LA appendage clot, and careful assessment of the mass location and its relationship to atrial structure is crucial to avoid mistakes. I hope this video has been both informative and fascinating. In the next video, we'll discuss another important pitfall in echo, so stay tuned for more advanced echocardiography insights.